Hello friends, welcome back. Today we'll discuss with the last category of female infertility, that is development problems, which indicates if there is any problems during the events of development of a fetus from the fertilization, very first fertilization till parturition. If there is any issue, it may cause or it may end up with the infertility in female, or it may end up with the malformation or kind of abortion in of the fetus. So we could see that those includes hard eggs and the teratogen. So we'll start with the hard eggs. Hard eggs, what are they? As the name indicates, the outer covering, the shell, it will be too hard, so that which obstruct the uh, hatching of the egg, so that may kill the embryo within. It may suffocate the egg and suffocate the fetus, and it may lead to the death of the fetus. So here the fetus or the embryo cannot hatch out. I mean, the embryo cannot hatch out from the zona pellucida and it may die. To fix this problem, scientists what they do is they make a tiny hole in that egg so that the egg head portion of the fetus can, I mean, the embryo can start moving out. Next problem is in the case of teratogens. Teratogens, these are the external sources which may cause harm to the developing embryo. It may include an infection from virus or a bacteria or any other pathogens, exposure to some dangerous radiations like X-ray exposures, gamma radiations or other radiations, and also because of poor nutrition. And the extent of malformation depend upon at what stage of the development they were being exposed to these type of teratogen. If it is like, for example, if it is an exposure at an 8th week of pregnancy, we can see it may cause the malformation of the fingers or stunting growth of the toes. So here we'll start with some common causes which may cause lead to infertility. These include medication problems, thyroid problems, cancer and other treatment. As an effect or as a side effect, it may cause infertility. Other medical conditions like HIV, AIDS, kidney diseases, diabetics, delayed puberty, amenorrhea. So these conditions can also cause infertility in female. And the last one we have already spoken about this, that is the excessive caffeine intake can one way or the other may lead to female infertility. Now we'll discuss with the treatment. What are the treatment possible? Here we can see that we know that as a treatment, medicine, surgery, artificial insemination, and ART, that is assisted reproductive techniques, are the recommended treatment measures for infertility in females. So normally in the ART and all that, what they do is they go with starts with a stimulation of ovulation. They give some super stimulating ovulatory some drugs to the patient so that the ovary respond in response to that will start developing more number of eggs. Then using some fertility drugs. So what is the component in the fertility drugs are normally making the ovulation process, it is stimulating the ovulation process in females. And about 2/3 of the couples who are treated for infertility, they are having a positive effect and they are having the opportunity to have a baby. And in most cases, the infertility is treated with drug or to some extent, if not to some extent with surgery. And if all these are being a failure, we can go for another method, that is one of the recommended method, that is assisted reproductive technique. We'll be discussing it in detail in the next video. It simply means we are assisting the reproduction, and here it is a kind of human intervention in the process of reproduction. That is, if the couple they are infertile by nature, we are assisting them to have a baby. And it is the basic phenomenon, the technology used is IVF, and it is best works when the woman has a healthy uterus. She responds well to fertility drugs and ovulates naturally. And if some problem, she can use with donor eggs also. Complications with art, we'll be discussing art in detail in the next video, but then just to have a summary, we could have an idea. We can say that complications with art is that it may end up in multiple pregnancy. It can cause ovarian hyperstimulation syndrome, like we are stimulating the ovary, so sometimes it may get overstimulated, hyper, that is leads to a hyperstimulation and syndrome, because it is backed with many symptoms. So ovaries may enlarge, cause pain, maybe there may be blottings, now and then there will be some bleeding droplets, and higher risk of PCOS in women can be a end result of having going for a art. Bleeding or infection can be seen, and if even if pregnancy happen, the child will be of low birth, the fetus will be low birth weight, and there may be some kind of birth defects to some extent. It's not like to the higher risk, but then there are risks like this. And how to then what? The other ways to battle infertility is to have a regular, to keep a good health. Regular exercise should be done, or avoid alcohol, tobacco, narcotics, caffeine, and all that. Then limit the medication. Unwanted medicines should be avoided, and at the end, eat a balanced diet. And other, and if nothing works, then what? Consider other options like adoption. You can go for sperm donors. That is your. It's not that sperm may not be biologically of your partner. You can go for the sperms from the sperm banks. If nothing works, you can talk to each other, can go to have a counseling service. You can talk to your relatives, your supportive groups, which may help you to get rid of all these complicated thinkings, and you it may help to get ready to be to come out of the depressions of not having a baby, and you can even adopt a baby. Thank you.